So good morning, ladies and gentlemen, guests and colleagues. Just by way of introduction, I am David Hefner. I'm the Executive Vice President for Clinical Affairs here at Georgia Health Sciences, and it's my honor and I'm delighted to welcome you here today. Because today we're embarking on a unique collaboration between scientists and our community members, and this collaboration is designed to improve public health not only in the CSRA region, but across Georgia. Just wanted to say a word about why in particular we're here today, and that is about the Community Health Partnership Grants Program. This program was established to pair the university researchers with our community organizations, and it's really in response to the public health needs in the region and across Georgia.
There's no reason for research to only be in ivory towers. This program puts it on the street, in the neighborhoods, in the places where it can really make a difference. I feel both honored and privileged to be part of this. And each and every one of you need to be excited about the difference that we collectively and individually can make.
In May of this year, Georgia Health Sciences University launched the Institute of Public and Preventive Health with a very specific mission to improve health, reduce health disparities, and prevent injury and illness in our community and throughout Georgia. And this is an institute that we have been waiting for a long time. Today, we take a giant step in that direction by teaming the Institute's research scholars with community organizations that are already in the trenches. Bringing the two together to create a synergy firmly focuses on finding ways to solve specific health problems in our region. These partnerships, these collaborations are the seeds for continued health improvement as we build on the results of this research. These grants are indeed an investment in our community, in our university, and in the state of Georgia. I appreciate your coming here today to celebrate with us. There are many things that we should be celebrating, and this is just one of those things which has a tremendous impact on our community. I would like to ask Representative Wayne Howard to join me as Dr. Mark Hamrick announces the recipients.
Thank you all again for coming today. I'm especially grateful for all the distinguished guests who have joined us on the stage. It's an honor and a pleasure to be able to announce our inaugural recipients of our community awards from the Institute of Public and Preventive Health. And I've got the best job, which is I get to hand out the money. So thank you very much, Dr. Ballas, for this opportunity. Our first award is to Melissa Bailey, the clinic director at Harrisburg Family Healthcare, and Fran Oliver, who's co-founder and executive director of Mercy Ministries, for their project titled Partnering for Success, HIV Screening and Needs Assessment in a Low-Resource Area. This project will enhance existing voluntary HIV testing in our community by training community health workers in the prevention and testing of HIV and sexually transmitted diseases, increasing testing among the homeless, medically underserved, and high-risk populations, and conducting a healthcare utilization and needs assessment to identify unmet community needs and resources available. Our second award is to Terry Black, and Family and Consumer Sciences Extension Agent at the Burke County Cooperative Extension. The project is titled Girls on the Run, an after-school program to engage preteen girls and reduce obesity in Burke County. The program aims to decrease obesity in one of Georgia's least healthy counties by teaching healthy food and physical activity skills to preteens with an evidence-based curriculum, and to collect data to allow for future program growth. Our third award is to Clifton Dennis, Chair of the CSRA Asthma Coalition, Dr. Joshua Lane, Community Pediatrician, and Susan Dilliard, School Nurse Supervisor for the Richmond County Board of Education, for their project titled Preventing Hospitalizations for Pediatric Asthma Through Improved Provider-Patient-Family Communication of the Asthma Action Plan. The project aims to establish an interdisciplinary team of community partners to design an education intervention and a series of workshops for all pediatric care providers at the Georgia Health Sciences Children's Medical Center, develop strategies and tools to improve communications between providers and asthma patients and their families, and disseminate those strategies to other community providers such as schools and clinics. Our fourth research award goes to Helen Blocker Adams, president of the HBA Group and founder of the Southeast Enterprise Institute, for the project titled Leadership for Healthy Lifestyles. This program is a community-based research demonstration project that will incorporate weekly classes on healthy lifestyles into an ongoing student leadership program at Pine Hills Middle School, extend the program across the CSRA upon demonstrated success, and solicit NIH funding to develop a clinical trial. Our fifth award goes to Julie Miller, Executive Director of Columbia County Communication Connections, for the project titled Health Promotion and Obesity Prevention and Intervention. The project will target multiple health behavior changes through an after-school program in the cities of Grodetown and Harlem by focusing on smoking, asthma, obesity, and fitness education for students and their parents. Our sixth award goes to Janice Sherman, CEO of Bell Terrace Health and Wellness Center, and Charles Williamson, CEO of Serenity Behavioral Health Systems, for their project titled Building Information Infrastructure for the Greater Augusta Healthcare Network. The project will build and reinforce JHN's information infrastructure, improve the data collection process and information dissemination to hospital emergency departments and community clinics, and strategically plan ways to reduce hospital ambulatory care sensitive conditions and increase primary care at clinics. Our seventh and final award goes to Debbie Layman, a great friend of JHSU, Executive Manager of Costa Layman Nursery in Trenton, South Carolina, for a project titled Cardiometabolic Risks in Hispanic Farm Workers, a health fair model study in the southeastern region. Multiple community partners engaged in this project will study multiple factors, including environmental, that may contribute to cardiometabolic risk of young Hispanic migrant farm workers and test the hypothesis that inflammation underlies that risk.
But let me make some comments about the significance of this event. As you know, latest research shows that 40% of cancers originate in the community, in lifestyle and environment. 60% of cardiovascular diseases originate in the community. 100% of injuries come from the community, from the lifestyle, from the environment. So these are our wonderful opportunities to prevent diseases instead of seeing them in our emergency room. And we can do better, we can do more, and this community obviously wants to lead in that regard. And certainly at this point, I would like to recognize the tremendous leadership of President Aziz in launching the public health initiative of Georgia Health Sciences University of Georgia, GRU Augusta University, and this is something that opens a new era for this whole region and for the state. So please join me in expressing appreciation for his leadership. I would also like to recognize other university leaders who contributed to that, and certainly Provost Kaufman's name comes to mind. She has been a truly outstanding supporter of the public health initiative, and IPPH specifically She devoted her entire professional life to advancing academia, and I can tell you that there are a lot of things that are not entirely clear how they will be defined in the new consolidated university, but there is one thing certain, that we will have an outstanding Vice President for Academic Affairs, Provost Kaufman. So please join me in expressing her support. Thank you for coming, and please join the reception. Thank you.